Hello everyone. In this new series of educational videos, we will be learning the treatment methods that are based on the concepts of functional release techniques. Now, functional release techniques are basically the soft tissue manipulation techniques that can be utilized by the physiotherapist to treat conditions that involve pain in the musculoskeletal system. Often during the examination of the musculoskeletal pain, the therapist comes across situations where there are presence of trigger points and taut bands within the myofascial tissue. Utilizing the functional release techniques, we can successfully release these trigger points and taut bands and help in improving the mobility as well as in the reduction of pain. So in this first video of the functional release technique, we will be covering the treatment for the TMJ pain as well as headaches that actually originate from the dysfunction of the masseter and the temporalis muscle. And just by demonstrating the treatment steps, it will become very easier for the physiotherapy students as well as young practitioners to understand the concept and steps that are required to follow the functional release treatment. So let's get started. So to assess any dysfunction in the temporalis muscle, the patient is going to be in the supine lying and the therapist is going to sit at the head end of the treatment couch. Now, as we all know that the temporalis muscle originates from the temporal and the parietal bone, and it goes down and behind the zygomatic arch and then attaches with the coronoid process of the mandible. So the orientation of the temporalis muscle fiber is like this. And we can feel this particular muscle if we can ask the patient to just clench the teeth. And this is where you can find the contraction within the temporalis muscle. Now, to examine this muscle for the presence of trigger point or taut bands, the therapist is going to screen this muscle while going across or perpendicular to the orientation of the muscle fiber. And what we are going to look for is any presence of trigger points or taut bands. Also, there can be capitus present within that particular muscle, and it will look like as if the finger is passing over a rubbery like structure. And once that particular tender point or trigger point is located, the therapist is going to deliver the second step of the treatment, which is to deliver a compression to that particular trigger point perpendicular to the particular muscle, and this compression is maintained for around 30 seconds or 60 seconds or 90 seconds. Now this will depend upon the time taken by the tissue to actually relax. So the idea behind deliverance of this ischemic release to the affected tissue over the trigger point is to actually create a temporary period of ischemia and then subsequently revascularize the tissue once we remove this pressure after 60 to 90 seconds with increased blood flow, increased oxygenation and increased nutrition that helps the tissue to relax and regain normal functioning. Now please note that the preferable finger of the therapist can vary. That means in this particular demonstration I am using the index finger to deliver the ischemic compression, but the technique will be equally effective if I utilize the middle finger or the thumb. So it all depends upon the handling of the therapist and personal preference. Now moving on to the next step of the treatment, because that is what the functional release is all about. We want to inculcate and produce the movements of the muscle during the treatment. So here what we are going to utilize is the movement of the joint across which the muscle acts. So while maintaining this ischemic compression, now we are going to ask the patient to actually produce the opening of the mouth and the closure of the mouth. Now as we all know that once the mouth is going to open, there is going to be elongation of the temporalis muscle, and once the patient closes the mouth, there is going to be shortening. Now during the functional release, while maintaining this ischemic compression, as the patient opens the mouth, we facilitates the movement of this trigger area or the taut band towards lengthening, and as the patient closes the mouth, we again facilitate the closure or shortening of the muscle. So this has to be repeated multiple number of times until the therapist feels a relaxation or release of the area. So the important thing to be noted is that the examination or palpation of the trigger point or taut bands always takes place perpendicular or across the orientation of the muscle fiber, and the functional release treatment always takes place along the orientation of the muscle fiber. So during the functional release, we are actually facilitating the movement of the taut band or the trigger point in the direction of lengthening and in the direction of shortening while maintaining the ischemic compression. And this becomes a very effective way to reduce swelling, inflammation, and also tightness within a particular myofascial tissue. Now similarly, let's move on to the quick examination of and treatment of the masseter muscle. The masseter muscle originates from the zygomatic arch and it gets inserted into the mandible. And now to quickly screen the masseter muscle, we again have to go perpendicular to the orientation of this particular muscle. So the therapist again examines for the presence of trigger point or taut band or again crepitus within this particular muscle, and those particular areas are going to be very painful for the patient. And after we have determined the area which is having trigger point, we are going to deliver the ischemic release for around 60 to 90 seconds, and followed by this we are going to deliver the functional release to the masseter muscle. So again, while maintaining that pressure or ischemic compression over the trigger area, the therapist is going to ask the patient to open the mouth and close it, and while maintaining that compression we are going to facilitate the elongation and shortening of the taut band or the trigger point. Now again, this can be painful for the patient, but patient needs to be explained by the therapist that after the treatment session is over, he is going to feel complete relaxation and relief in his symptoms. So in summary, when we combine three techniques, that is ischemic compression, facilitation of elongation and shortening of the trigger point, trigger area or taut band, along with movement of the joint across which the dysfunctional tissue is attached to, forms the functional release treatment. And in this particular series, we will be covering the common functional release treatment that can be utilized by a physiotherapist to treat a variety of problems that often we see in our physiotherapy OPD. So see you all in our next video. Till then, keep learning, keep sharing, and stay connected.